You know, usually when we talk about a medical diagnosis, there's this expectation of precision, right?
Yeah.
It's like engineering. Like
Yeah.
you break your arm, the x-ray shows that jagged white line, and the doctor just points and says, there it is.
Yeah.
Let's cast it.
Yeah. It's a very clear-cut process.
Exactly. Welcome to part 2 of our diabetic foot care series, where we are focusing entirely on footwear and protection. And, well, if you tuned in for part 1, you already know that when it comes to the diabetic foot, that clear binary engineering mindset is exactly what we need, but it's rarely what we actually get.
No, it's really not. I mean, it's incredibly comforting to think we can just walk into a store, point to a physical problem, and, buy a quick over-the-counter fix.
Right.
Human nature just craves that convenience. We want to categorize our pain quickly and make it disappear with, like, a swipe of a credit card.
But then you step into the world of diabetic mobility, and suddenly you realize that convenience is actually your worst enemy.
Oh, absolutely. It's a trap.
So today, our mission is to help you understand how protecting the diabetic foot requires completely abandoning what is essentially retail guesswork.
Yes.
We have to trade that in for clinical precision if you want to ensure long-term mobility. And for this deep dive, we're going to be exploring the clinical philosophy of Michael L. Ashley. He's a board-certified pedorthist with over 20 years of clinical expertise based down in the Dallas-Fort Worth area.
And right there, we should probably clarify something vital because terminology really matters here.
Oh, for sure.
When people hear foot specialist, they immediately think of a podiatrist.
Right, like the doctor you go to when you have, I don't know, a new-grown toenail or you need foot surgery.
Exactly. A podiatrist is a physician and surgeon, but a board-certified pedorthist is different. Think of a pedorthist as the structural engineer and the biomechanical pharmacist for your foot.
A biomechanical pharmacist, wow.
Yeah, they don't perform surgery. Instead, they design, manufacture, and modify custom footwear and orthotic devices to manage biomechanical anomalies. They deal strictly in the physics of how your lower limbs interact with the ground.
Okay, let's unpack this, because the biggest mistake people make with foot pain, especially diabetic foot pain, is trying to solve a structural engineering problem at a standard retail shoe store.
It is a massive trap, and, you can't really blame the consumer.
Right, 'cause you don't know what you don't know.
Exactly. Your heel hurts, so you go to a place that sells things for feet. But retail orthotic stores and standard shoe shops are fundamentally structured around sales volume, not medical intervention.
Yeah.
Their entire business model is designed to treat surface-level symptoms. You walk in complaining of heel pain, and the associate points you toward a wall of brightly packaged, store-bought insoles.
The classic gel pads. You press them with your thumb right there in the aisle and think, wow, that's squishy. That's going to feel amazing. Problem solved.
It's a very common reaction.
But going to a retail shoe store to fix diabetic foot pain is like, it's like buying off-the-rack reading glasses at the pharmacy to cure a complex degenerative vision problem. I mean, it might feel okay for a minute. The text might look a tiny bit clearer when you put them on, but it's not actually correcting the root issue inside your eye.
That is a brilliant analogy. And it perfectly captures why relying on retail guesswork is so dangerous. A retail insole just adds a layer of generic cushioning. But cushioning does not equal alignment.
That's a great point.
Right, because if your foot is mechanically breaking down because your ankle rolls inward too far with every step, a condition called overpronation, a soft gel pad isn't going to stop that mechanical failure. It's just going to be a soft surface that you continue to roll inward on.
So the pain might be slightly masked, but the damage is still happening. Like, you're still rolling.
Exactly. And if you are managing diabetes, trusting a commissioned retail salesperson to properly align your skeletal structure can lead to severe, life-altering consequences.
Yeah, that's terrifying.
It is. A pedorthist, on the other hand, brings clinical expertise to address the actual root cause of why the foot is breaking down in the first place.
So we're throwing out the retail guesswork. No more squeezing our feet onto those little metal sliding measuring devices at the mall and, just hoping the size 8.5 is going to cure our joint pain.
Please, no more of that.
This means we have to understand what true clinical precision actually looks like in practice. Because it's not just walking in and pointing to a shoe on a wall.
Not at all. A true clinical approach relies on a very specific 3-step fitting process. And step 1 is a comprehensive clinical assessment.
Which I'm assuming goes way beyond just finding out if you have, like, wide or narrow feet.
Vastly beyond that. I mean, the Pedorthist evaluates the static structure of your feet, absolutely, but the crucial element is evaluating your gait. They need to see the foot in motion.
Right.
They look at your kinetic chain.
The kinetic chain meaning how the foot connects to the ankle, the knee, the hip.
Precisely. Every time your heel strikes the ground, your body has to absorb and distribute an immense amount of shock.
It makes sense.
If your foot mechanics are slightly off, that shock travels improperly up the leg. They also evaluate your current footwear to look for specific wear patterns. A heavily worn down inside heel tells a completely different mechanical story than a worn down outside toe.
Let's play devil's advocate here for a second, though.
Sure.
Is a full dynamic gait evaluation really that necessary just to get a comfortable shoe?
Yeah.
If I know my arch is what hurts, can't the clinician just build an arch support and call it a day?
And that right there is the exact mindset that leads people back into the retail trap.
Oh, okay, fair enough.
Think about the physics of the body. If your arch hurts, we have to ask why. Is it because the plantar fascia, the band of tissue supporting the arch, is too tight? Or is your ankle structurally unstable, which causes it to collapse inward when you walk, putting secondary tearing strain on the arch?
I see.
If I just shove a rigid arch support under your foot without evaluating your dynamic movement, I might push your foot outward, creating a brand new problem for your knee. You have to treat the disease of the movement, not just the symptom of the pain.
That makes total sense. You're mapping the blueprint of the problem, which naturally leads to step 2, the custom solution plan.
Right. Once the mechanical breakdown is identified, the Pedorthist creates a highly personalized roadmap. This is where they determine exactly what materials and devices are needed. Are we building custom orthotics? Are we utilizing specialized footwear?
And when we say custom orthotics, we aren't just talking about a piece of molded plastic.
No, not at all. The material science here is fascinating. An orthotic designed for a diabetic patient is a complex medical device.
Wow.
The base shell might be a rigid polymer to control the heel bone and prevent that dangerous inward rolling we talked about. But the top cover, the part actually touching the foot, might be made of a specialized closed-cell foam called plastizote.
Plastizote, what makes that so special?
It's designed specifically to reduce shear stress.
Shear stress.
Yeah, shear stress is basically friction. It's the side-to-side rubbing motion that occurs when your foot slides slightly inside your shoe. For a healthy person, shear stress causes a blister.
Okay, uncomfortable but fine.
Right. But for a diabetic patient with poor circulation, that blister can easily become an open ulcer. The materials are chosen scientifically to eliminate that friction.
Which brings us to the final step of the process. Precision fit and follow-up.
Yes. What's fascinating here is how the custom orthotic and the footwear are engineered to harmonize.
Harmonize.
Yeah, you can have the most perfectly engineered, clinically accurate orthotic in the world, but if you drop it into a shoe that doesn't have the proper volume or the right sole rigidity, the entire system fails.
It's like tuning a piano. You don't just tighten the strings and immediately walk on stage to play concerto.
Exactly.
You have to strike the keys, listen to the resonance, make micro adjustments to the pegs until the tension is absolutely perfect. The shoe and the insert have to play the same chord.
A beautiful way to put it. The shoe itself acts as the foundation for the orthotic. If the shoe's foundation is unstable, the orthotic becomes unstable. This is where the clinician fine-tunes the mechanics so everything works together for lasting comfort.
And this idea of the shoe acting as the foundation really opens up a broader conversation, because once you have that clinical assessment and that custom orthotic, you have to look at what the foot actually does all day, right?
Right.
It's the principle of matching your footwear to your specific movement.
Exactly. The biomechanical demands on a foot are completely different depending on the daily mission.
Here's where it gets really interesting. When we hear terms like specialized performance footwear, our brains automatically default to athletes.
Oh, absolutely.
We picture marathon runners analyzing their stride or tennis players needing lateral support. And yes, a Pedorthist absolutely helps active runners get a stronger stride. But where this clinical focus proves its real-world value is in occupational mobility.
Yes, 100%. Think about the people whose entire livelihood depends on their feet surviving an environment of constant mechanical stress.
We're talking about culinary professionals in commercial kitchens, warehouse workers navigating concrete floors, hospital nurses pulling 12-hour shifts.
And now let's connect this back to our primary focus, diabetes.
Okay.
Imagine you are a warehouse worker in Duncanville. You spend 10 hours a day walking on unforgiving concrete. Now imagine you also have diabetic neuropathy.
Ouch.
The sheer mechanical force being driven into your skeletal structure every single day is immense. If you rely on retail guesswork in that scenario, you are actively inviting structural collapse.
Which is why the clinical practice we are looking at offers something called the Gold Standard Work Fit Package.
Yes.
It's priced at $430, which includes a significant discount from the retail value, and it perfectly illustrates how serious this occupational protection needs to be.
Let's break down why that package is engineered the way it is. It combines hands-free, slip-resistant footwear with those precision-built custom orthotics.
Now wait, I understand the slip resistance. If you were in a commercial kitchen or a hospital, you need traction to prevent a fall. But why is the hands-free aspect so clinically important? Is it really just for convenience?
It's absolutely a clinical feature, not just a luxury. Think about the physical reality of a diabetic patient who might also be dealing with obesity, joint pain, or limb mobility.
Okay, yeah.
Bending over to tie, untie, and adjust laces multiple times a day can be a significant barrier. If putting on the protective shoe is physically difficult, the patient is less likely to wear it.
That makes sense.
Right. A hands-free mechanism ensures the patient can easily step into a secure, locked-in environment without struggling. Furthermore, traditional laces can create uneven pressure across the top of the foot if tied improperly, restricting vital blood flow. A properly engineered hands-free shoe provides consistent, safe tension.
Wow. I never thought about laces acting as a tourniquet for someone with compromised circulation.
Most people don't.
That is a massive insight. And, $430 might sound steep to someone used to buying $50 sneakers at a big box store. But when you compare it to the cost of treating a foot ulcer or taking a month off work because you can't walk.
It's an investment in your literal foundation.
Exactly.
It's risk management. And as we transition fully into the diabetic foot care protocol, that concept of risk management becomes the entire game. A Pedorthist doesn't just give you shoes, they provide a highly specific arsenal of protection.
Because neuropathy changes everything.
Completely. Neuropathy is the loss of sensation in the extremities, often due to nerve damage from elevated blood sugar. For a healthy person, pain is an essential biological alarm system.
Right.
If you get a pebble in your shoe, it hurts, so you take the shoe off and remove the pebble.
But with severe neuropathy, that alarm system is disconnected. A patient might step on a thumbtack or develop a massive friction blister on their heel from a poorly fitting shoe and literally not feel a thing.
They might walk on that thumbtack for 3 days.
Oh my gosh.
By the time they visually notice the wound, it has often become a severe, deep tissue ulcer that is incredibly difficult to heal due to poor diabetic circulation.
So the first line of defense in this clinical arsenal has to be specialized diabetic footwear.
Yes, these aren't just extra wide sneakers. Diabetic shoes are engineered with extra depth to accommodate custom orthotics without crushing the toes. They are built completely seamless on the inside.
Because a seam is a physical ridge, and a ridge causes friction.
Exactly. They also utilize specialized diabetic socks, which follow the same principle. They are seamless, but they are also non-binding at the top.
To avoid that tourniquet effect we just talked about with the laces.
Precisely. You cannot afford to restrict arterial blood flow down to the foot or venous blood flow back up to the heart. Furthermore, these socks are engineered with advanced synthetic blends to wick moisture away from the skin.
Because moisture leads to fungal infections and skin breakdown, which is a fast track to an ulcer.
Exactly.
It's fascinating how every single detail is about eliminating microscopic risks. But there's one piece of this protective arsenal that honestly blew my mind, because it addresses an environment most of us consider totally safe. The inside of our own homes.
Ah, yes. You're talking about indoor protection, slippers and sandals.
Yes. The clinical approach places a massive emphasis on supportive slippers for what they call end-of-day relief.
If we connect this to the bigger picture of human behavior, when are you most likely to walk around barefoot?
Definitely at night. You take your work shoes off, you're walking around the kitchen making dinner, or getting up at 2 a.m. to go to the bathroom.
And that is exactly when the diabetic foot is most vulnerable to unseen catastrophic trauma.
Really? Just walking around the house?
Yes. Your house is a minefield of potential injuries. You could stub your toe on a door frame, step on a stray Lego brick, or simply subject your unprotected foot to the harsh, unyielding impact of hardwood or tile floors.
So protecting a diabetic foot isn't just about what you wear outside. It's a 24/7 commitment.
Yes, it is.
Wearing supportive, clinically approved slippers indoors is just as vital as wearing your work boots on the job site. The clinical mindset cannot clock out just because you walk through your front door.
Never. And for patients who have progressed to higher levels of risk, the clinic introduces much more intensive tools. One of the devices highlighted is the diabetic neuropathy gauntlet.
The gauntlet. See, when I first read that, my mind immediately went to this giant metal medieval armor situation. But that's a terrible metaphor, isn't it? It's not about heavy metal, it's about advanced engineering.
Exactly. A better analogy would be the roll cage inside a professional race car.
Oh, a roll cage.
Yeah. A roll cage is incredibly lightweight, but its geometry is designed to take the catastrophic force of a crash and redistribute it entirely away from the driver.
Okay, so how does that translate to a foot gauntlet?
A diabetic neuropathy gauntlet is a custom-molded, highly structured boot mechanism. When a neuropathic foot is highly unstable or actively breaking down, regular orthotics aren't enough.
Right.
The gauntlet physically locks the ankle joint in place to prevent those dangerous side-to-side shear forces we talked about earlier. More importantly, it uses total contact technology to redistribute the patient's body weight up the calf and away from the vulnerable sole of the foot.
Wow.
It's offloading the pressure. It's a clinical tool designed specifically to save a limb from amputation.
Which forces us to look at the physical reality we face if we get this wrong. We've talked about the clinical assessments, the gait analysis, the custom orthotics, the seamless socks, the gauntlets. But what happens if someone with diabetes ignores all of this? What happens if they just keep buying the cheap retail insoles, wearing unsupportive shoes, and hoping for the best?
The clinical reality is devastating. When diabetic neuropathy is neglected and bad mechanical forces are allowed to continually pound an unprotected foot, it leads to a condition called Charcot foot.
Charcot foot. It sounds almost innocuous, like a French designer brand, until you dive into the pathophysiology of what it actually is.
It is a condition of severe progressive osteoarthropathy.
Okay, big words. Break that down for us.
Let me explain how it happens. Because the patient has neuropathy, they lack the neuromuscular reflexes that normally protect our joints. If you or I step awkwardly and put too much pressure on a bone in our foot, our brain instantly senses the pain and subtly shifts our weight to protect that bone.
Naturally, yeah.
A neuropathic patient doesn't have that reflex.
So they just keep walking, driving full mechanical force into a compromised bone structure over and over again.
Exactly. This causes microfractures in the bones of the foot. The body senses the trauma and initiates an intense inflammatory response, sending extra blood flow to the area to heal it.
Which sounds like a good thing, right?
You'd think so, but this rush of blood actually washes calcium out of the bones, making them soft and spongy.
Oh, wow. So the bones are weakening precisely when they're taking the most mechanical abuse. It's a vicious cycle.
Yes. The weakened bones fracture further. The ligaments stretch and tear. And eventually, under the weight of the patient's own body, the entire architectural structure of the foot completely collapses. Completely. The arch falls so drastically that the bottom of the foot actually bows outward, creating what clinicians call a rocker bottom deformity.
The literal foundation of the body caves in on itself.
It makes walking incredibly dangerous, if not entirely impossible. And that protruding rocker bottom bone creates a massive pressure point on the bottom of the foot, which almost inevitably leads to severe ulcers, bone infections, and ultimately amputation.
This is why the clinic's focus includes what they call advanced Charcot foot stabilization. You are literally trying to keep the building from falling down.
Stabilization is the only defense. The protocol relies on early detection. Recognizing the warning signs like unexplained swelling, warmth, or redness in a neuropathic foot, and intervening immediately with extreme clinical precision. You use custom orthotics and custom footwear to rigidly stabilize the foot, prevent that structural collapse, and keep the patient safely and independently on their feet.
So what does this all mean? When we look at all these concepts, from the intricate mechanics of a gait analysis to a warehouse worker slip-resistant package to the intense structural defense of a diabetic neuropathy gauntlet, it's all telling the exact same story.
It is a story of structural integrity.
Yes, this isn't just about finding a comfy shoe so your heel doesn't ache when you sit on the couch at night. It is about actively stabilizing your body's architecture. It's about recognizing that whether you're trying to survive a 12-hour culinary shift without knee pain or trying to protect a vulnerable diabetic foot from collapsing into Charcot foot, you absolutely cannot guess your way to health in a retail aisle.
Absolutely not.
You need a comprehensive assessment. You need a custom biomechanical plan. You need precision fit. That is how you maintain your mobility.
It is the fundamental difference between masking a symptom and correcting a disease. Retail is a temporary mask. Clinical pedorthics provides the structural correction.
And that wraps up part 2 of our deep dive into footwear and protection. We've explored the deep mechanics of why a clinical relationship is absolutely mandatory for your long-term foot health and why the quick trip to the mall is a trap. So we challenge you, the listener. Right after you finish this deep dive, go look at your own closet. Pick up the shoes you wear every single day. Look at the wear patterns on the soles. Do they truly match your daily movement? Are they supporting your unique kinetic chain? Or are they just retail guesswork?
And as you hold those shoes, I want you to consider this final thought. If our feet are the literal foundation of our entire body's alignment, how might the retail guesswork shoes you're wearing right this very second be subtly rewriting the story of your posture, your joints, and your long-term mobility for the next decade?